My name is Misael Soto, and this is my storytelling project video for MAS 365. I will be going over the topic of socioeconomic disparities of farm workers in Idaho and its impact in health and wellness. It's safe to say that farm workers are an essential aspect of our economy. This is more apparent now during the time of the coronavirus pandemic. However, even though manual laborers produce most of the country's and even the world's consumable food, these groups of people face harsh economic, social, and geographical hardships themselves. A large majority of these people are of a racial or ethnic minority group and commonly immigrants, often working in rural locations where they are made to be invisible to a majority of the public. Similar to other parts of the country, Idaho farm workers face an abundance of social and economic barriers, no thanks to Idaho's 7.25 minimum wage, inadequate housing for migrant farm workers, and working exaggeratedly long hours. These may be factors that play into the food security and eating habits of manual laborers to maintain their well-being. I know it may be confusing as to why I'm focusing on farm workers in Idaho, but it's because it has a close and personal meaning to me, since I was born and raised in a farm working household in Idaho. I'll offer my own personal experience being born and raised to put this into perspective and how it affected me and my family before we touch more on the logistics of the impact on health and wellness. I was born and raised in a traditional Spanish-speaking farm-working immigrant household. My parents, along with my two older sisters, came from the town of San Vicente Palapa in Guerrero, as shown in this picture, to a town called Glens Ferry in Idaho, essentially swapping a rural and poor community in Mexico for one in the United States. It was a story we know all too well. My parents wanting to provide a better opportunity for me and my siblings, which happened to be made possible by the availability of farm work for my family to partake in due to the lack of language skills required and instead using physical labor. All of my sisters worked in the fields with my parents starting early on in their teenage years. I remember waking up at 5 in the morning during the summers in my youth, dressing for the fields, loading up for a family van, and heading to the grape fields, where I would be told to just sit in the shade as they worked. Different years and different seasons made the type of labor and crop vary, from cleaning onion weeds in the summer to harvesting the beets in the late fall with my dad as he drove the tractor. This is the tractor that he would drive. There wasn't a lot of income coming in, especially for a family of five, but somehow my parents managed through a lot of mental and physical exhaustion. I remember the consistency of having frijoles and arroz for dinner in big chunks at a time, or being constantly told by my parents to eat at school due to our qualification for free breakfast and lunch. It was something that I was oblivious to when I was young, just because it was my normal. When I was in school during the academic year in elementary, my parents would have already been up and out of the house by the time I woke up at 7 a.m. to catch the bus. And I wouldn't see them at home until 6 p.m. later that day, long after I had arrived home from school. Living off of a 2 hour interaction with my parents that was barely even an interaction, since they would shower, rest, and make food and prepare for the next day before I had to fall asleep at 8 p.m. for me to go to school, built a very distant relationship and made me form my own sense of independence. I remember when I was younger that I would want to hug my parents when they would get home, but would push me off as if they didn't want to receive it. Although I was hurt, I didn't know that they just didn't want to cover me in the chemicals that existed in the fields. All these pictures of farm workers that are cycling through contain my parents in the fields close to my house. In this picture, my mom is the one wearing the green Mexico sweater. I would clean the fields alongside my mom, my friend Lizette, and live off of a 30-minute lunch for a 10-hour day. And although it wasn't my preference, in a town as isolated as that, there wasn't a lot of opportunity for employment elsewhere. So I worked in the fields in late middle school all the way through high school. My parents, now at the ages of 61 and 62, still work in the fields. My mom has prediabetes and my dad has hypertension. The subject of farm workers is very important to me, which is why I decided to focus on the impacts that farm work has on health and wellness, especially in regards to socioeconomic status. My mom's here cleaning the onions, and then this is my dad. This is me and my friend Lizette when we were in the fields over the summer, my junior year of high school. The national rate of food insecurity in farm workers ranges from 20% to 93% in multiple research studies, as I found in an article called Food Provisioning Strategies Among Agricultural Workers in Southwestern Idaho. But in Idaho, a study conducted by two members of the Boise State University team on the food and dietary habits of farm workers showed that a majority of farm workers, 71% to be exact, had at one point or another experienced some form of food insecurity. A large percentage, 79%, of the farm workers stated that the high cost of food within the state limited the type of food that they could buy, often having to buy food that they weren't very fond of eating. This disparity is in and of itself a huge health hazard, and in one word, sad. A study conducted in another article, The Effect of Safety Net Programs on Food Insecurity, showed that food insecurity only shifts by 1.1% when farm workers are given a $1,000 cash stipend. And in farm workers' case, most likely less, since these results focus primarily on single-parent families. Hypothetically, if the government were to grant these households cash assistance, the state would lose a drastic amount of funding. This issue then turns into a matter of whether states want to provide this assistance, but in states where large populations discriminate against undocumented immigrants, it serves as a big disadvantage and is seldomly a possibility. Funding plays a big part in food provisioning and health for these farm laboring families. In turn, food provisioning, or the ability to plan and prepare meals, is affected tremendously as a lack of decent funding, which then impacts the dietary needs of minority farm workers in Idaho. Is it a shock that a majority of farm workers struggle with diabetes? No, because it makes sense when the starch-filled treat is more affordable than fresh green vegetables. Most farm workers are of Mexican descent, approximately about 95%, within the state of Idaho, with almost 45,000 farm workers being undocumented immigrants. Due to their immigration status, this affects their ability to qualify for access for safety nets like the Supplemental Nutrition Assistance Program, SNAP, or Medicaid. Due to this, only 7% of undocumented farm workers are able to utilize the WIC program, or were able to utilize the WIC program during the years of 1993 to 2009, as opposed to 12.4% of documented households in Idaho. Among the most common food and nutrition programs for farm workers in Idaho stand food stamps with about a 16% inclusion, WIC with about 18% inclusion, and Medicaid with approximately a 37% inclusion. If food stamps or food assistance were to be given in place of cash assistance, as mentioned earlier, there wouldn't be a significant difference. Therefore, the percentage of farm workers within a food stamp program remain with the possibility of facing food insecurity in their household. The ability to qualify for food and nutritional programs are all dependent upon immigration status. No undocumented farm worker can apply until they either become a U.S. citizen, be a resident of the state where they're applying, have a social security number, fulfill other legal requirements, or use their children's eligibility. To qualify for programs like WIC or Medicaid, families must either have children, be older than 65, or have some sort of disability. Many farm workers do have families, but a large majority are either adolescents or adults who have entered the country independently. These manual laborers are left out of the ability to be eligible for these kinds of programs due to the inability of having proper documentation, living with a family, or having a disability. Thus, 71% of farm workers who've reported food insecurity may largely be due to the inability of having documentation or qualifications for access to proper food and nutritional programs. According to a study from 2010 about the finances of farm worker families nationwide, a family of five on average made somewhere between $12,000 to $16,000 a year. The federal poverty level for a single person is just $12,000, while for a family of four, the poverty level is $24,000. The difference in both statistics is honestly eye-opening. What does this financial disparity cause within the health of farm worker children? Well, on average, Latinx farm worker children are more likely than non-Latin white children to not have enough to eat, to be iron deficient, or to be overweight. A possibility for this health and nutrient outcome could also largely be due to access to food and nutrition programs or even proper educational attainment. Farm worker children typically have the highest dropout rate, which could affect their ability to participate in USDA school food programs like the National School Lunch Program and the School Breakfast Program. Typically, children enrolled within these types of food programs have many benefits: improved overall nutrient intake, academic performance, better behavioral issues, and lower obesity rates. If farm worker children have lower school attendance rates compared to non-Latin white children, then it makes sense. Another aspect to explain the poorer health of farm workers' children are consistent food shortages. Reducing food variety and increasing consumptions of cheap, starchy, and sugary foods leads to high caloric intake, but families are left without a choice due to the affordability of these types of foods as opposed to healthier alternatives. The health disparities among farm worker families are honestly devastating and tragic. While the United States can have a 20% low food insecurity rate in farm workers, Idaho and farm workers are towards the top of the spectrum with a food insecurity report rate of 71%. The ability of the government to offer assistance does very little to help ease this statistic, which leads to a large negative impacts on the health of farm workers. The farm worker majority consisting of undocumented Mexicans worsen their chances for government aid due to the inability of having the proper qualifications or documentation status. These health deficits not only affect the farm workers themselves, but also their youthful offspring who struggle with consistent food shortages, obesity, starvation, and iron deficiency. All in all, farm workers in Idaho are at a major disparity when it comes to food security and welfare. I would know firsthand. Who knows though? Maybe with the coronavirus pandemic highlighting manual laborers as essential, attention can finally be brought to solve these issues for the nation's largest producers of consumable foods. Thank you so much. And these are the references from all the statistics I pulled on impacts of farm workers in Idaho on health and wellness.